The main advice, again, is seeking out mentors and being aggressive at doing that and finding people to learn from. But what I mean by aggressive, that doesn't mean you're looking to take from the mentor. It means that you're willing to serve and to help and to provide value to that mentor in return.
Always excited to have the next guest on. The pleasure of speaking with a passionate, outspoken leader in the world of orthopedic manual therapy, Dr. Tim Flynn. He's a clinician, researcher, educator, and now writer who has dedicated his career to challenging the status quo of the U.S. healthcare system. Through his new Substack platform, Own My Health, Tim advocates for a shift in focus from the sickness industry to empowering individuals to take control of their own health. Now, with decades of experience, Tim remains a staunch supporter of manual therapy and a critic of the inefficiencies in modern healthcare. Now, today, we'll dive into Tim's vision for where the field of manual therapy is headed, his critiques of the healthcare system, and how we as clinicians can better support patient autonomy. We'll also discuss the role of the Foundation for Orthopedic Manual Physical Therapy in advancing the profession. Yeah, all in one conversation. Up next, Tim Flynn here on Hands On, Hands Off. Tim, welcome to the show.
Oh, thank you very much.
AM 2024 going on in the background. How's your conference been so far? You've been here for a couple days.
Been a couple days, yeah. Started out with some board meeting yesterday for the Foundation Orthopedic Manual Physical Therapy. So that was yesterday, and now some good sessions.
Yeah. What are you looking forward to here specifically? What are you looking forward to learn?
Well, to learn, I mean, part of the learning is just the discussion after the talk, like
elbow rubbing time.
It really is, like what did that stimulate in you? And I've actually had some great conversations. So it's as much the presentation as the discussion afterwards. And
hallway talk.
It is.
Yeah,
it is.
It's these things going on here, or
for sure.
On my podcast, the tagline we used for a while was "the best conversations happen at happy hour." I saw it as a student when I went to a conference, and I'm like, but I learned everything at happy hour.
Exactly.
I learned a lot at happy hour.
And it's so true that that's when real conversation happens. And just making space for that is absolutely the highlight of this conference for me.
I was talking with Nathan Hudding, which we gave the keynote, and he said, he was a little late for our interviews. I apologized. I said, no worries. He said, I asked on stage if anybody had any questions, and no one said anything, and then everybody clapped, and then they rushed the stage. Exactly. I like those questions.
Yes.
Those are the questions I like to ask. So I'm going to ask some of those to you, if that's all right.
Okay, fair.
Right. You've always been an advocate for manual therapy. You wouldn't be an AOMT if you weren't. What do you see as the core value of manual therapy in today's healthcare landscape, especially if the system becomes more reliant on technology and less personal communicate or personal interaction? What do you think the core value is?
I think the core value remains the power of human connection and the ability and the power of the laying on of hands on another human being. It's just, how sometimes popped to your mind, just finished The Covenant of Water by Abraham Verghese, who he has the classic TED Talk on the power of the physical examination. It's one of my favorite TED Talks. It just renewed my faith in the essence of great healing in medicine has always been the ability to connect to another human being across from you and to hear their story. And we have the added value of the power of the laying on of hands to guide someone to health. And, that's our value prop. In the time when everything else is going the opposite direction, if you will, that you can measure everything and see everything to the most detail, people aren't really feeling that I want a cold machine being the provider of my healthcare. So that's what I think is our still and always will be our value prop.
I think it's everything we just talked about before I asked that question, which is, hey, the sessions are great here at a conference, but it's that connection between those things. It's the grout between the tile that really holds everything together.
Well stated. Yeah. It is the connective tissue for sure.
Yeah. You referred to U.S. healthcare system as a sickness industry. And I think that changes sort of the lens that you look it through, right? So unpack what you mean by that and share how that perspective has sort of changed or maybe shaped your approach to patient care and teaching.
Yeah, I mean, I sometimes feel like I'm getting jaded and cynical, and I don't want to be a cynical human, so I always am careful reflecting, but it just continues to hit me in the face. The stories, literally every week I hear from friends, family, acquaintances on their interface with the current system and how rapidly they got escalated into some harmful interventions that should never have gone that way. And I mean, we talk a lot about the musculoskeletal side, but that's just the tip of the iceberg,
right.
You know, where you see the lack of just problem solving, clinical problem solving at the first step. Before any technology happens, that that really good hypothesis generation, and saying, well, we fail to see the harms that happen when we overdiagnose. And I think so when I say the sickness industry, it's actually all these factors are in play that say we should do more and more and more. We should do more testing. We should do more intervention versus no, doing less is actually more, doing the minimal amount that's necessary. And the vast majority of problems, watchful waiting is a very important strategy there, and we've created everything, or not everything, most problems of chronic problems, which is the vast majority of what we see, we've made them feel like they're emergency problems, and we treat them that way with high-powered things that have a downside of high risk and harm. So to me, it's really about the harms that are happening in the sickness industry. And when I say the incentives are, again, to do more.
Right.
So it's the incentives are misaligned in our system.
Yeah.
And we just, it is not good.
Yeah.
My son and daughter-in-law live in France, and we rail against, the systems in other places. And, the quality of care in the type of care they received after their, our first grandson it's unreal.
Yeah.
Like for instance, you're just all women are given, pelvic health PT up to 10 sessions if needed after delivery of a baby. That's just normal, type of care. So anyway, it's frustrating in our current sickness model.
Yeah, I mean, you use the word incentives and how much is given and also when. And if I were to throw a cliche or an anecdote, then the ounce of prevention would be worth the pound of cure. And what if you never needed that pound of cure?
Yes, indeed. And that I think shifts to, and maybe it's further questioning, where we're heading. I mean, clearly, as manual therapists, I have a lot of thoughts on that.
Yeah. You've got your own Substack.
Just started, yeah. So I just have a few posts here and there, and just it's kind of my son said, Dad, you need to start like getting. You talk about this all the time. You need to start talking louder.
It's not even. It's a great way to organize thoughts, to make it easy for people to read. Because I use the term. Life now happens online at the speed of swipe.
Yeah.
You can miss a lot of really great for people who talk loud and often. Yeah. And sometimes the quiet messages that are said infrequently are actually the best. So why'd you begin writing was my first question, but you said your son sort of prodded you like, hey, you got great ideas, put them somewhere.
Yeah, and this thing kept coming in my head, because your journey is both personal health journey and for others, and just keep going, what am I really saying? And so it's really own my health, and that the idea is that we need to own our own health. We because the system doesn't want you to be healthy, so we have to own it, and that means we have to be smarter about every encounter that we have, and that we have autonomy over our bodies and autonomy over our decision making, and that's really the kind of the impetus. And so it started, I kind of outlined some chapters and things about own my health, how to avoid harms caused by the medical system, and really that's kind of the thought as I'm kind of working my way through it, and just kind of thinking in those ways.
Yeah.
And even if I connect to one person out there and can prevent them from doing something that they end up wishing they had, and I'll feel like I was successful.
Well, you beat me to my next question, which is when people start communicating, because that's my background, I get excited. Yeah. You decided to write. I was going to ask, how will you know if you've achieved success? And you said even if I reach one person, that will be success to you with this endeavor.
It will be. And I think that's, and it's a way I feel like I can then begin to create conversations, even within the local network of friends and family, to say, hey, just, slow down the decision-making process. And I do, it's kind of, I get calls all the time. A lot of it's musculoskeletal, but I do a lot of advice that, people would say, oh, that's outside your lane. No, I know medical literature. I know how to dissect clinically relevant questions that may not be in the realm of my specialty. And it's really teaching people to, you should ask this, this, and this. It's your decision. It's your body.
Right.
It's your health. But to your medical provider, these are the key questions that you want to ask. And I actually sort of use a similar example, but use some of these, and telling, family member, when you go there, you should, these are questions you should ask. And the response was, where did you get these questions?
They're not, because a lot of times providers aren't used to it. You are the abnormal thing.
Yeah, exactly. And they're not, I always say, don't ask him in a confrontational way. It's always a curiosity.
Sure.
Well, I've heard.
Right. Help me understand.
Yeah. And, so it opens up the conversation. And to your like, well, yeah, now that you say that, and it's amazing, even at end of life, my father-in-law was very clear on wanting his exit strategy to be non-interventional. Still, the system tries to intervene and continue to give kind of medications that are not quality of life improving, but maybe, longevity improving, but in a point of time where I'm not interested in longevity, I'm interested in quality of life.
Right.
And just asking, well, what if I don't take these? What if I just drop taking all these medications? Well, actually, this is what, maybe we should taper this one, but, that's totally fine.
Yeah.
But just going, unless that question was asked, it was just continued to do the same thing that's been in there.
That's what a system does. A system exists to system.
And it just keeps perpetuating, And again, I don't think it's bad. There's bad actors, but that's not the problem anymore. It's a bad system,
right. And we march along.
And we march along.
And a lot of us will raise our hands and say, where can I change this? But a system is difficult to change because it is many people from many angles.
And that's why I kind of go back to the, own my health. If I can empower one to own their own, they can fight against the system.
Right.
Or at least, then they're in the driver's seat.
Yeah. Well, we are at AAMT. The podcast is called Hands On, Hands Off. So I'll get you a manual therapy question. You've seen manual therapy evolve over the years. It's got to be a pretty cool perspective. All of a sudden you realize, like, wow, I've got pretty a vast perspective of looking backwards. Where do you think the field's heading, though, if we look in the future?
It's funny how things kind of go for full circle. I'm honored to receive the Menell Service Award today, and one of my first faculty mentors was John Menell, back at Michigan State. Yeah. And Phil Greenman was really my other just huge mentor in my life. But again, and the osteopathic college at Michigan State, and when foundations of osteopathy were always about, holistic type of care. And now most osteopathic schools, like any other medical school, they've lost, the hands-on manual aspects. I mean, it's electives at many of the osteopathic programs. The old school osteopath that was very much a manual medicine person, they're really a dying breed, and yet the foundations of those principles were really at the heart of osteopathy and why they went different than the medical model route, which was very disease oriented and based primarily on medication, and
sure.
And so it's kind of like we're going back to, well, that's not what we need. It's going back to the fundamentals of really looking at the whole body. So I guess I kind of lost your question. It was what is the future?
Yeah, what you're talking about where we were, so that's a great place to start virtue. Where do you think the future's going, or what do you hope it does?
Well, I hope it's that we finally practice at the top of our license, and that's, we often think top of the license is, I was in the Army for 20 years, so imaging and, maybe limited pharmaceutical injections or things like that. And I'm like, when I think top of the license, I think I'm the provider of choice for this human in front of me. The movement system intertwines the cardiovascular system in your gut and your nutritional system and your mental system and how you view the world and the interplay of all that within chronic pain. So when I think top of the license, I'm like, okay, yeah, I mean, things that, precision medicine to me means, I'm asking about, more functional medicine things like your gut microbiome. What are you eating? Have you ever had tested? What does that look like to you?
Right.
What does sleep look like? What does, tell me more about your mental health and how things are going. And because we have tools for that treatment, exercise being one of the most powerful, but just mindfulness, breathing, and those types of tools that are in our scope of practice.
Right.
And it's in our scope to ask someone, how are you feeling? And I think we've kind of, again, we've siloed things like, oh, that's maybe psychology or, or psychiatry, which, there's clearly there's always a spectrum. But the vast majority of problems are, can be handled with low-level, non-pharmacological interventions. And a trusted colleague to help you along the way.
Yeah. You talked about the Foundation for Orthopedic Manual Physical Therapy, investing in future, investing in research. I get to sit on the board of trustees for the Foundation for PT Research.
Outstanding.
It's really interesting to see all the work that goes into it that has to raise the funds and disperse the funds, but it's important for the future of our profession, right? I mean, the things that you're doing now and we're doing at the Foundation for PT Research, we might not see those reap benefits for years and years, but it's important to do those things. So you're a vocal advocate for that. You were here earlier in the week for meetings. Talk about the work that your foundation does and why it's crucial for clinicians to invest in that for the future.
Well, again, just like the Foundation for Physical Therapy, our future depends on the ability to continue to learn, grow, and take that back into clinical practice. I'm a clinician. I see myself as a clinician that is informed by science that is continually evolving. So that's a big part of it, is the research arm. And, we've been fortunate to fund some large grants through the generous foundation. The Paris Foundation has donated, and over 3 years, $100,000 grants we've been will be distributing, but also scholarships to fellows. Another arm is providing scholarship dollars to fellows in training to offset the cost of their tuition. So those are really the big arms, and our belief is, we believe in orthopedic manual therapy and the future of people going and getting expertise, as demonstrated by being fellows in the AAOMT.
Yeah, it's important for the future of these things. Now, you do a lot of different things. That's a fancy way of saying it, right? So you say clinician, you see yourself as a clinician first. Teacher, writer, we talked all about those things in this conversation. And you've influenced many in the field of physical therapy in our profession. What advice would you give to the next generation of manual therapists who are entering a healthcare system that looks very different than the one that you entered?
Yeah. Well, the main advice, again, is seeking out mentors and being aggressive at doing that and finding people to learn from. But what I mean by aggressive, that doesn't mean you're looking to take from the mentor. It means that you're willing to serve and to help and to provide value to that mentor in return, the learning. So, I mean, to me, it still goes down to great mentorship and the ability to see master clinicians at work, because they're out there and they're working in a system that, is dysfunctional, but there's new ways. I mean, we're seeing more and more like, people, it's direct to consumer, and you're PT for life, and you're on the phone. There's all different models of payment now that one can do. So to me, though, it still distills down to you need to be good at what you do. To me, there's a basic skill set of expertise and listening and hands-on care, and then, of course, finally, that of a lifelong learner. If you actually think you're getting that then you really should leave. And that's when I've always said, if I'm not learning, it's time to get the hell out of the way.
Yeah,
because
I get stuck, in your advice sort of resonates with me, is when I get stuck and when I can't get unstuck, It's when I keep going to things and not people to get unstuck. And the funny thing is I fall into the same trap, and then as soon as I start to crawl out of it, I'm like, oh yeah, why didn't I think? One of these days I'll start thinking about people first in terms of the solution. But I think that goes to I want to feel like I can solve this without people, right?
Yeah.
But people are they're usually the solution, even if it's a conversation.
It's so interesting, and we're so disconnected now because of the ability to, distract our mind with a device, which is such a short period of our humanity, these devices that we can distract our attention and away from the human interaction of having a great conversation. And that one probing question that might go, and it may be something that's been in the back percolating, but nobody's articulated it.
So you're like on the cusp of saying what my two greatest compliments are. Like I don't want to think about what I'm going to write on my tombstone or what people are going to say at my eulogy just yet. But the two best compliments that I think for a podcaster, but it's for clinicians or people, is I've never, the two levels, it's like A and A1, which I've never thought about that before, which means in a world full of access to information at fingertips, you just brought up something that someone has never thought about before. Like, that's amazing. Like, how great of a compliment is that? And there's only one that's like a percentage point better, which is I never thought about that way. And what that means is you have spent time thinking about that. And someone has just given you a way of thinking about it and looking at the Rubik's Cube from a different angle. And that's an amazing thing. And that's different than just being able to Google something or read or listen or watch something. Those are different. Those are human activities. Those are thinking activities.
They're totally thinking. And I like that last one you just said, because it is that way, but it's the prepared mind. It was just ripe, and it just needed that little bit of a drop there, and you're like, shit, that I've never thought of it that way.
Yeah. I often joke with my former professor, and she was my advisor in PT school, Sky Donovan. I always say she was the worst professor ever. I'd ask her questions, and she just gave me more questions. I'm like, I need you to give me the answer, and she's like, well, number one, the answer kind of depends, but I want to show you how to get your own answer, because in a couple of years you're not going to be standing in front of me in class. I'm like, I guess you're right. I'm going to think about it.
It's so much of life is. Again, it's that contextual nature of things, and expertise is truly that. It's ability to read a room, the ability to understand that, context, and therefore the likelihood that this, whether it be intervention, this word, this thought, this deed, will have the most impact. But it's complicated. It's complex and complicated.
It is. So. Last thing we're doing here with all these different conversations at AMT is like a parting shot. Is there something that you said in this conversation or something you'd want to leave the audience thinking about or focusing on as we wrap up? Like a mic drop moment, soapbox statement, whatever you want to call it.
Yeah, well, probably I would just say, I would go back to this concept, since we're at AOMP, that everyone here needs to really understand the value that we have to society, and there's never been a bigger need for what we do. And when I say what we do, that's listening kindly, thinking with, being a human with the person across from them, and then providing really kind care to them to make their day, but more importantly, their life better.
Yeah, well said, Tim. Appreciate your time here at AMP 2024.
Okay, thanks, Jimmy, for all you do, man.